Good morning, everyone. Welcome to the third edition of CITYNET webinars organized by All India Institute of Local Self-Government and CITYNET, and also this webinar is supported by EMDA Southasia, Pilot for Dev, and many other host organizations. All of us are aware that cities are changing, especially in the post-pandemic world. We have seen the cities were the hardest hit when this pandemic started, and then when cities were dealing with these challenges evolving from pandemic, whether to manage solid waste management, provide health services to their citizens, or other basic services to urban informalities. So these cities were struggling to cope up with the evolving new challenges. So in the post-pandemic world, we have realized that building local resilience is paramount if cities have to achieve sustainable development goals and other global goals that were decided by many global agencies, including United Nations, UN Habitat, New Urban Agenda, and other nations, like when they came together and decided their collective actions for their global action plan for climate change in Paris in 2015 and onwards, so that every nation is making their individual plans to cope up with the challenges of climate change, of disasters, and several other issues that our cities are facing. So in today's webinar, we are going to focus on how urban local bodies, our municipal corporations, our cities can address these challenges and provide local solutions to build local resilience, make themselves not just infrastructure resilient, also how to build their economic resilience, so that in the future to come, if they want to take any initiative, any program they want to take up, so they don't face any resource or financial constraint. So this webinar will focus on building urban local resilience from the perspective of climate change impacts, also the post-pandemic world changing urban priorities, and also the economic resilience of urban local bodies in India, in South Asian countries, and how cities are going to address the evolving challenges. So I will not take much of your time. We have a very illustrious panel of speakers today. So I will invite first Professor Isabel Milbert, who is the president of Pilot for Dev. She is graduated in law and political science at the University of Paris, where she specialized on Indian law and urban management. She arrived in Geneva in 1988 to teach at the Graduate Institute of Development Studies and carry out research and consultations for various assignments, Swiss Development Corporation, French ministries, and international organizations. From 2001 to 2004, she headed project team on governance, human development, and environment under the NCCR North-South. So I will invite Professor Isabel to give her insight on how cities can build resilience, what are the challenges they are going to face, and how they can address these challenges. I think Professor Isabel has one PPT to present. I will request our team to please facilitate that. Over to you, Professor Isabel.
Thank you so much, sir. It is so fantastic to be with you today, and thanks to for the organization of this. I'll just start with recalling the diversity of origins of the concept of resilience, because it is important. It is a cross-disciplinary concept which actually originated in physics and then was appropriated by psychology and biology. Please take the next slide, please. And this origin is extremely important because resilience relates also to the fact that being resilient doesn't mean that you will go back to the original state, but it means that the person or the tree or the metal will come back to a state where it can continue, where it can survive while it is different. And this is exactly the case now in the crisis that we are going through with the pandemic. In the field of international organizations, their approach to environmental hazards has been very much using resilience. And I can quote here the UN Sendai framework: prevention, preparedness, early warning, recovery, and reconstruction enable to build this resilience. But you can see that whether in the West or in Asia, in the state of the present crisis, unfortunately, we have not been able to follow this chain of preparedness. Can we go to the next slide, please? Thank you. Vulnerability naturally is aggravated by the deficit in urban services, in this problem of natural risk management, which has been grossly neglected, sometimes even in rich countries. We all can think of the Hurricane Katrina in New Orleans, which was one of the worst examples of a rich country neglecting the governance of risks management. The deficit in industrial risks management, in man-made risk, the conflicts of all kinds, but also the vulnerability is aggravated by poverty in some cases, and also by the neglect of local management. We will come back to this. So this pandemic crisis comes in a context where all over the world, the public health is deteriorating due to industrialization, pollution, growing inequalities, habitat crisis, and loss of biodiversity. And now the next slide will show you an extreme case of building housing, self-built housing in the suburbs of La Paz, where you can see how a chronic housing crisis creates, you can imagine the state of these houses in the times of rains, for instance, and heavy rains they have in the country of Bolivia. So we don't know if this state of affairs is adaptation, mitigation, or resilience. Next, please. And another question is, have we too much trusted the economic growth? We, at one point, it was considered that economic growth, which is the main asset of cities, which is really their stronghold, that this was going to solve all crises. But we can see now that unfortunately it is not the case. Next, please. So now, what would be the strategies for strengthening resilience? Naturally, public policies are at the core of these strategies. There is a need for a recognition of the central role of city services, as was recalled, if a city doesn't have proper water, if the citizens cannot use water, for instance, if there is, how can we go on, you see? Strengthening the local government level is going to be key. We can see at the moment in Europe that this local government level has been key in the implementation of the measures to fight the COVID-19. Building a trusting relationship with local communities, and then building inclusiveness, trans-level, vertical and horizontal communication. All these points we can see, for instance, if we take the French government, that it has missed the present pandemic. It has been missed in the present pandemic crisis. And quite often it is not a question of money, because, for instance, if you take the example of Cuba, which is a poor country, when they have a hurricane, for instance, they hardly ever have human lives lost. They have very few casualties because the governance at the local neighborhood level is absolutely impressive. And you may remember that it is not a democratic country either, but the relationship with local communities is excellent. And in the case of disasters, there is an excellent trans-levels vertical and horizontal communication. Technology and cooperation bring solutions, as we can see in the COVID-19 crisis, but not completely. And technology, as you know, has its own limitations, and sometimes too much trust in technology can lead to further disasters, as we have seen in Europe several times. Next, please. So which resistance capacity, which absorption capacity, which recovery capacity can we have, can we build in the context of the COVID-19? Definitely, this vulnerability in health hazards is associated to uncertainties in politics. We have seen the linkages with an economic crisis, although we can see that it seems that several countries are now recovering rapidly. And this link with local communities in a context of rapid climate change must really be addressed. So how can we arrive at something that would be called negotiated resilience, which is quoted, Professor Harris is quoted, for instance, by my friend and colleague, Pascaline Gabory, that some of you would know. For me, the key issue of the discussion today is how to be able to take into account social movements around climate change, around disaster mitigation, and now around public health. How can we rely on these social movements to address these new governance issues? And then how can we foster political action based on consciousness of the implications of climate change on public health and also on cities management? Because the COVID-19 crisis is closely related to environmental hazards issues and to climate change. So in the years to come, we will have to integrate these public health issues into the local cities management. And this is the heart of the debate for me today. Thank you. Next, please. Thank you. Thanks a lot.
Thank you, Professor, for telling us that the political proactiveness, the good governance model at the local level, and also the social movement is at the center of building local resilience. You have given the example of Cuba. Despite having limited resources, they have been able to mitigate the impacts of disasters and loss of human lives. Thank you so much giving us examples and telling us how local leadership, good governance models can help us building local resilience and also achieve several global goals. Thank you so much. And now I would like to invite Mr. Manohar Patole, who is a Co-City Fellow and Project Manager in the Co-City project with NYU's Man Institute and Georgetown's LabGov initiative. As a Co-City Fellow and Project Manager, he collaborates with Co-City principals in applying and adapting the Co-City protocol in Baton Rouge with the East Baton Rouge Redevelopment Authority. His research interests include data for development, environmental gentrification, local government innovation, and urban wash policy. Over to you, Mr. Manohar Patole, for your insight on building local resilience. Before I invite you, I would like to tell our audience that please, you can submit your questions in the Q&A sections. And after all the speakers have spoken, we will take some of the questions for discussion, and relevant speakers can answer those questions. Now over to Mr. Manohar Patole for his presentation.
Thank you, Abhishek, and I'd like to take the opportunity to thank the organizers, CITYNET, and the partners for this great project and initiative that you guys have been doing. I'd also like to thank a very special thank you to my colleague Vishnu Rao, who I went to university with. Well, it seems like yesterday, but it was it was a little bit longer ago, for connecting me with everyone on the call. And then I'd also like to give a special thanks to all the resilience communities we live with and work with. Our successes are based on their work and their tireless efforts on making their corners of the world a better place for them and their families. So for me, just wanted to give you a brief introduction. I am also an adjunct professor of sustainable urban environments in NYU's Tandon School of Engineering. And I'm on the planning committee for our New York City's Municipal Art Society. So I am calling you from the East Coast of the US. So I apologize if I yawn or seem a little bit tired. It is 2 a.m. But I work in Baton Rouge, Louisiana, which was and still is a receiving city from New Orleans. It is the capital city for the state of Louisiana. It is the hub for major petrochemical plants like Exxon and BASF. But it also is a city that is a stark contrast of economic development with respect to the haves and have-nots. And this is a very commonplace thing throughout the world. It's not exclusive to the developed or the developing. But what I'd like to talk about first is just give you a brief understanding of what Co-City is, and then I'll go into our recent insights. So Co-City Baton Rouge is a partnership between LabGov and the Merit Institute of Urban Management at NYU, as Abhishek has just mentioned. And it is a multi-stakeholder approach for economic revitalization and social revitalization in the city of Baton Rouge, Louisiana. It applies something called the Co-City Protocol for the first time in a US city, but has been applied in Europe and in Latin America. And it looks at a racially, economically, and socially stratified mid-city. A mid-city in the US context is something between more than 100,000 but less than 1 million, which is the more commonplace urban environment here. It is designed to create an environment that pools resources and expertise of multiple stakeholders to support residents as the central actors in the neighborhood or the community for revitalization, and thereby enabling them to shape and develop their outcomes and serve as the long-term stewards of the community. The institutional policy and infrastructure prototypes created through our project targets the needs to address local community and what they have identified as the essential goods necessary for its own health and sustainability. Uh, Specifically, these needs can range from a variety of things, but they're usually developed internally and organically. For example, in Baton Rouge, we're looking at affordable housing, accessible green space, local capacity building, and as we've also emerged, food insecurity as well. We look at intending to scale these prototypes up based on the projects from the city level to share with the world. And we're looking at the experience in Baton Rouge to apply our knowledge in other places within and outside of the US. And one of the things I'd like to talk about and build upon what Professor Isabella had already mentioned, but also challenge everyone else here, is this idea of local governance and capacity. I think more often than not, when we're talking about the resilience in COVID, it's been very paternalistic, it could be more colonial, it can be very top down. And I think what needs to be respected and what we've observed over these past now more than 18 months, I've lost track of the time, as many have, is that our local communities are more knowledgeable about what they need than what we can tell them they need. For example, one of the things that has established out of our work once we shifted to being all virtual is something called it's called One Rouge, which is a weekly call in which we engage all community stakeholders on what resources are available and how we can connect them to that, whether it's healthcare, whether it's food, whether it's something else. And it stemmed from this idea that it was an area that, that experienced Katrina, and me being from New York City, but it stemmed from this idea of after the academic year ends, how are we going to feed our children? And this kind of spurred this organic need to we need to take care of our children. We need to make sure that they have the resources they need to survive. And you may think of this as, well, this is the U.S. Why would you have such issues? To quote a BBC reporter from earlier this year, you can classify the U.S. as a third world nation with a Gucci belt on. The idea is that we have, many countries, not only the U.S., but has discounted and avoided investing in infrastructure, whether it's physical, social, or economic, for everyone, since World War II. And that lack of investment, as the professor mentioned earlier, has led to many of these issues that we're experiencing today. Bringing up to what we're talking about now, building up local capacity is many people, many communities have the knowledge, understand what they need, and can provide it. What they do not have is the understanding of the local systems that govern them. And that prevents them from actually engaging and really addressing their own needs. So one of the things that we have tried to do and tried to build is something called navigational capital. This idea that goes beyond an economic good, but is a social good that provides the education, not only this formal stuff that you would learn in the classroom, but how do you engage with politicians? How do you engage with local organizations like CITYNET? And how do you articulate your needs in such a way that it actually resonates with these policymakers, managers, technocrats, so that they listen? I think more often than not, what happens with communities is that these communities are angry and upset, and they kind of channels in a way that, although their message is clear, but the emotion kind of outweighs that. So as we look forward in building local resilience, one of the key ways and one of the things I'd like to leave on is this idea that all of our communities know what they want. Try not to be colonial and paternalistic about the suggestions. Build from what they say. Do not, one size does not fit all. I'd like to thank you all and look forward to your questions.
Thank you, Mr. Patore, for your for giving us insight on how the importance of local community and engagement with local community for building resilience at the local level. Thank you so much. And now we would like to move to Dr. Luthra, Dr. Ashwini Luthra. Sorry. Who is Director for Center for Sustainable Habitat, Guru Nanak Dev University, Amritsar. Experienced teacher and researcher, he has demonstrated history of working in the urban transportation, infrastructure, and environment sectors in the education industry. He is a strong community and social service professional, skilled in sustainable habitat development, urban planning, transportation planning and management, infrastructure planning and management, urban and regional environmental concerns. I would like to invite Professor to this for presenting his views to the audience. Over to you, Dr. Luthra.
Thank you, Mr. Pandey, for inviting me to this very important talk. And I will make my own presentation because this is PDF and I have the PPT with me. Kindly permit me to share my screen.
Sure, sir, you can do that.
So after listening to learned speakers before me, of course, I have gained a few more things, but my dimension of talk is towards city planning, largely because resilience of the cities we are talking, and it is with reference to city planning and its developmental needs, where we should stand and how the cities should be resilient to such pandemics in the future also. In that regard, you have disabled me for presentation. Kindly enable.
1 minute, sir.
Yes, it comes now.
You can share your screen, sir.
Yes, I will share. Can you see the presentation?
Yes, we can. We can see. Yeah.
Thank you. So I would be talking on the same topic which where the theme of the webinar is, that is building local resilience in the post-COVID world. And my focus, as I told you, that it would be on the cities, how the cities should behave. And for this, I will hit at this GD, this Global Development Goals, goal number 11, that is sustainable cities and communities, where the objective is to make cities inclusive, safe, resilient, and sustainable. And on the right side, we have what the United Nations gives us, how we can have or we can build sustainable cities and communities. Among us, this 11.5 and 11B becomes important in the sense that they talk about the disasters. Of course, natural disaster is there, but probably now this pandemic kind of thing, this is also disaster. Of course, the controversy is whether this is natural or man-made, but still, these two become key areas where we should strive. And in this reference, what are the challenges that COVID has posed to the sustainability of the cities? And for these challenges, we have to go into the background, how in case of India, the challenges are, that is polarized urbanization. Because if we see, most of our population, urban population, is settled in the bigger cities. So if we see the COVID data also, then it is that in the bigger cities, the impact is more because the densities are not properly distributed. Some core areas are more densely populated compared to the peripheral areas. That's why the impacts are more. At the same time, the sprawl of the city is also not very, very planned kind of thing. Unprecedented urban sprawl is there. As a result of which, the spread of pandemic and hence how to control pandemic, that also becomes a challenge. Poverty, slums and housing, these are again areas of concern in pandemic conditions. Inadequate mobility options, infrastructural deficiencies, financial deficiencies of the local bodies, that also becomes a concern. Similarly, the opening speaker talked about the technological aspect also, and in case of India, technological hitches also has is a challenge in countering the pandemic. Similarly, local governments, they were not say efficient enough, or they were not having that capacity to govern this phenomena. Of course, over a period of time, the local governments have also learned how to fight with the pandemic, but at the same time, still many capacity building programs or practices, they need to be exercised. So in this reference, taking these challenges, I would hit at three aspects, that is health infrastructure, accessibility and mobility, and livability and social justice, because these three key areas, they are the cause of concern, or they become the concern with respect to the resilience of the cities regarding the pandemic situation. For health infrastructure, I'm not going into any data because the data is available to everybody. I'm going towards the suggestions. The suggestions are that the future cities, they need to have a rationalized and optimized use of the health facilities. We have to rationalize. This is more important because the super specialty hospitals, they have, I would say, minted money out of it. But if the government sector intervenes and then rational utilization of the health facilities that is there, then pandemic control would be more efficient. Similarly, distributive justice of health facilities. If spatial distribution of the health facilities is done in a very justified manner, again, a lot of population will not be congregating at one point. Then for special persons like aged, children, differently abled, we have to develop health infrastructure so that under pandemic conditions, these can be taken care of very efficiently. At the same time, because this hygiene becomes a cause of concern in Indian cities, so smart cities sanitation plans need to be prepared so that a preventive act can be there. At the same time, health system plans, they need to be prepared because the cities don't have health system plans for pandemic and disaster. So like disaster management plans at the district level, cities need to have health system plans. Regarding accessibility and mobility, we need to have more balanced land use transport planning so that accessibility improves. We need not travel longer distances where crowding in the vehicles cause breakup of this pandemic situation. Similarly, design self-contained communities so that the local needs are met within when we are countering the pandemic. Similarly, non-motorized transport-centric planning should be there. Now, this will lead to more safer and green mobility because individually the people are moving. So that group behavior is not there, so pandemic eruption would be lesser. So in that relation, promote micro-mobility for social distancing. Because once you are getting at one terminal, getting down at one terminal, from there, wherever you need to travel shorter distances, say public bike sharing kind of thing, or e-scooters can help in micro mobility. Similarly, encourage safe and healthy mobility of all for social justice. For each and every one, mobility and accessibility needs must be fulfilled. Make mass transport, mass public transport, the first choice of people. And here, for mass public transport, we have to devise ways and means where sanitized systems are introduced, or sanitization systems are introduced within the public transport system, which are automatic, because manually the things will not work in my perception. So bring about more of green mobility by promoting e-transport systems, because that will improve accessibility, that will improve mobility on the on one side, I would say, but it will save the environment also on the other hand. So regarding livelihood and social justice, because livelihood is more concerned with the earning, but here livelihood is also taken as living also. So for this, two concepts are advocated. One is 15 minutes city, and second is integrated township. Now both the concepts, they are with regard to meeting the needs of the people locally. So the walled cities in India, because they are the developments of the Renaissance and medieval period. So if you analyze these settlements, then you will find that most of the needs are met within the fortified township, which is developed on 15 to 20 minutes walking distance concept. So for this walled city of Amritsar and walled city of Jaipur, they are exemplified. And at the same time, developing integrated townships, where like Magarpata in Pune, these white dots, they are nothing but IT houses, and all other are the residential. So when your travel needs are cut and you can walk down, so that group behavior will not be there, and hence this pandemic counter would be there. So many other examples like Amanora in Pune, and then Chandigarh is the best example for such developments. Like each sector of Chandigarh city, it has a walkability principle, and all the sectors have their own sector markets. The work areas, they are there. The schools are there. The medical facilities are there. So it is in this sense that we need to develop walkable, bicyclable, self-sustained, and green communities, which will be in line with SDG 11. So it is with reference to this, I would say that if the world has to live with Corona, which is a statement of WHO now, then let us build resilient communities, because part and part, if we develop the communities, then the whole city would be a resilient city. Thank you very much.
Thank you, Dr. Luthra, for giving us these Indian examples where Indian cities have already worked on 15-minute city concept, like in Chandigarh or in Pune and various other places that you have mentioned. So I am very sure that the cities those are participating today, when they are building their plans, they are taking some initiatives for building resilience, they will keep this mind while planning their cities, while making projects for their respective cities. Talking about cities, I would like to move to the representation from National Institute of Urban Affairs, Dr. Uma Maheshwaran Rajshekhar. This because all of us know in India that National Institute of Urban Affairs has been hand-holding cities, providing them training, improving their capacities to deal with the evolving challenges of cities. And NIA is also celebrating 45 years of the establishment. So without further ado, I would like to invite Dr. Uma Maheshwaran, who is a chairman of the Urban Resilience Unit at the National Institute of Urban Affairs. His expertise is in the area of spatio-temporal modeling and analysis. He has worked extensively in the field of modeling and for redevelopment of systems of society and institutions to prepare, manage, and adapt to changing environmental conditions. In his current role, he works on vulnerability and climate variability analysis, urban environmental modeling, network analysis, and technological intervention for societal change. Over to you, Dr. Uma Maheshwaran, for your presentation.
Thank you very much, ALSG, for organizing this particular event. It is very important that we have such conversations as we move forward to not only look at systems in terms of what has failed, but it's also important to look at what we can do as we, as community and cities, grow and develop and evolve over the next few decades to a century. With that, I would like to highlight a couple of things. Many times these kinds of pandemic or hazards or extreme events provide us with a window of opportunity. Of course, our systems are tested and they provide a good reflection of what works and what doesn't work. And we need to, and there is also a good, memory and sense of pull and push or pressure, both top down and also bottom up, which creates a, a good, mechanism or provides us of the platform to engage with both government and also with community. So even though this pandemic has caused pain and suffering to people at large, I also think that it provides a framework of what needs to be done as we move forward. There are two things which I wanted to highlight. One is the formation of the UN. It happened post the World War. And if you look at India, the establishment of National Disaster Management Authority, which happened after the super cyclone in Odisha, 1999. So it was established in 2005. And when we talk about disasters, even though human beings have been experiencing disasters for quite a long time, it's not something which is new. But if you look at the institutions, they are very, very new. At the national level, the NDMA was established in 2005. Many of the state governments were mandated to, establish the State Disaster Management Authority, somewhere close to 2009, 2010, when I think one of the previous speaker was also talking about the Sendai framework, they were mentioning about SDG 11, which is talking about the Sendai framework, which was launched in 2015 and it is functional until 2030. So disaster management, even though human beings have been doing that for a very, very long time, in terms of institutional setup, in terms of community engagement or the role of community looking at disaster management has been something which is very new. It has evolved over the last 20 to 30 years. In the earlier times, it was always the government which was made the key agency. And even now, government plays a key role. But government plays a key role when a disaster has occurred, and then post-disaster management or during disaster management. We have the NDRF, we have SDRF, we have the local law and order, we have the district administration. We have a lot of people getting themselves involved when the disaster is taking place. But what is more important right now, and what as a community we need to think about, is pre-disaster situation. How can we do a better planning? How can we do a better, systems, or have better systems in place, or put a better communication mechanism in place? People who, I've seen a lot of NGOs and a lot of community-led organization mobilizing teams on the ground. But that is not something which they managed to do that only during this disaster, because they have been doing that for the last couple of years, and they used the disaster as an opportunity to scale up some of their efforts or to reach out to people in need. So it's very, very important to keep the communication, keep the community engaged, not only during the disaster, but also in a post-disaster situation, and also in a sustained manner, continued engagement. Unfortunately, in India, we don't have the system of, where we can basically take a public opinion on our plans and policies, even though most of the things are uploaded online and people have, people seek opinions from others. it becomes very, very difficult for government to engage in a meaningful debate. Of course, there are events where people talk to the government and vice versa, but it's not a meaningful engagement. But these kinds of disasters provide a good opportunity for people to reflect on what works, what doesn't work, and how things can be taken up in a manner which can be more sustainable. With that, I'll stop here, but we'll be glad to take more questions. Thank you.
Thank you, Dr. Uma Maheshwaran, for telling us showing us in the rearview mirror that how urban development and disaster in Odisha, super cyclone in 1999, led to the formation of several government agencies who are looking after disaster risk mitigation and empowering urban local bodies in India to respond to these natural disasters. I'm sure that these agencies are working tirelessly to improve resilience at different levels. But the major question still remains that the urban local bodies are still lacking knowledge, resources, and also tools in many states in India. They are not, they don't have the capacity at the local level to respond to these crises. And that's why we have seen during the pandemic, most of these corporations were not really very active. Some smart cities command and control center definitely responded to the crisis and came forward. But municipal corporations at their own level, local governance, city leadership were seen not that active, because a major role was taken up by the district administration. So we have to look at how we can improve urban local governance mechanism. Many of the speakers have mentioned this point in their presentation, in their speech earlier. Now moving to, we'll move to Sahana Goswami, who is a manager at Cities Program of WRI. Ms. Goswami is a manager for the Cities Program at WRI India. She works on urban water issues, including blue-green infrastructure, reuse and resource recovery from urban wastewater streams, WASH, access to vulnerable communities, and data-led planning for water-resilient cities. At WRI India, she has also worked on transit-oriented development and provision of safe access to transit station areas across urban centers in India. So I'm very sure that she will be able to shed light on different aspect of mobility, water management during the pandemic and otherwise during disasters, how big cities at their own level can address those issues. Over to you, Ms. Sahana.
Thank you, Abhishek ji. Good afternoon to all, and thank you all to the organizers for inviting me to this session. And I'm really glad to have this opportunity to speak on this forum and alongside this really distinguished group of speakers. So thank you for that. Not so much on the mobility piece, Abhishek ji, I'll speak more on the water piece. Though, as you mentioned, I have some experience working around that sector, around safe access also. But so my remarks, I just have remarks, I'm not presenting anything at this point. So from a water perspective, during the COVID crisis, we sort of again got this firsthand look at how critical water and sanitation is for us to have a healthy life. All of us locked in at home. And that's when we really realized how much water we drink. We need it every time we go to the bathroom, to wash our clothes, wash our vessels. It's really key to how we live our lives. But we have always known that clean water for drinking and household needs is very important and significant to improve health outcomes. So, constantly we have heard of cases of cholera outbreaks or typhoid outbreaks because water contamination has happened or clean water is not available. And we know that our government has actually been working towards this. We have the Smart Cities Mission, Amrut Mission, and we have this, and we would say that government authorities have extensively tried to improve conditions in urban areas. But I would contend there is still a key gap that is remaining. While we do all of these services, we sort of miss out on having very targeted services to the poorest in our cities, the people who end up living in slum settlements, whether informal or formal. They certainly do not have access to all of these things that many of us take for granted. And slum dwellers are 1/3 of our urban population in India. That's almost 160 million people who are struggling daily to access water and or sanitation services. And just imagine this whole group of people, and all of us have seen these photographs of people crowding around tankers, crowding around public water taps. And most affected, of course, are women in these communities who have this burden of collecting and storing water. And what we often miss out on realizing is that it's not just the collection of water, it's tied in with their livelihoods, it's tied in with their health, and it's tied in with generational mobility for them. Imagine young children in these communities who do not have access to water being unable to go to school. And that just, and during the COVID crisis, of course, with online school and all, we know there's a whole other layer that people, poorer people in urban communities do suffer much more disproportionately than people who are slightly better off in terms of earnings and incomes. And during COVID, what we really saw was this limitation of what we have done for these slum communities so far. We have often offered common services, common toilets, public taps, and we say that they have access. But during COVID, we realized that that isn't enough, because this is when we had all these images of people just crowding, forced to crowd around, public tanks and public taps, tankers, because what else would they do? They do need access to these services. And social distancing, of course, goes for a toss in these conditions. So if we talk of these cases, the question is, why does it matter? Why do we need to focus on these communities specifically? And I think in terms of urban resilience, a big part of our push in the future has to be on improving conditions for these people specifically. So first, again, as the pandemic has shown us, the people living in these spaces, they really are the workers who are driving our cities. Our cities are running because the sanitation workers, the industrial workers who live in these communities are working in our cities, and them not having access to these basic services of water and sanitation, of hygiene, of just healthy spaces for them to live in is definitely impacting the productivity of our cities. The second thing is that when we talk of pandemics such as COVID or the impacts of extreme events because of climate change, whether it be floods or water scarcity and drought, the urban poor are again more affected. They have to spend up to half of their income on just accessing water. Just imagine our households having to do that. That's unimaginable. And finally, if we in India are committed to meeting the SDGs, which talk of just and fair and equitable cities, how can we even think of doing that when, unless all of us urban residents and urban authorities choose to ignore such a large proportion of our fellow urban residents? So in terms of solutions, I would say this is something at WRI we have started working on. Not for very long. We have started what is called the Accelerating Access Coalition. And in this, we work on this theme of improving access to water, sanitation, hygiene, and healthy spaces, and to grow an ecosystem of organizations who would work in this space to look holistically at WASH. As I mentioned, we have Amrut, we have a lot of other programs, a lot of state-run programs. Say Telangana has its mission Bhagirathi of providing 24/7 water to every household. But that's just water supply. And if we have water supply without sanitation, we have sanitation, which the Swachh Bharat mission has done to a great extent. But if that doesn't have water supply, it doesn't close the loop. We need all of these services together. And to do this, what we are proposing is a really three-pronged approach. So first of all, of course, we have this big discussion that we should have centralized services. No, we should have decentralized services. But that's not the issue at all. We have to move away from that and say we need the hybrid solution which offers these services to these communities. And the next thing we need to do is also build in climate change into our solutions, which we haven't done to a great extent, because we often talk of or the government solutions, or even if they are sort of NGO-led solutions, they talk of providing the water tap in a community because that's enough. But now we know because of climate change, we don't know if that water tap will give us water 5 years down the line or 20 years down the line, and that has to be factored in. Because we can't just talk of, today we have the water tap, we have water supply, and we have given the solution. That's not enough. And finally, to be able to do all of this, as we see with programs like Amrut or programs that are headed, say, by a lot of other NGOs and the community themselves, we can't have them working separately. They have to work in tandem, they have to work as a coalition. And only then can we implement solutions, learning from what the community actually needs, but bringing the best of ideas from our global communities or from our national and national partners. So thank you. That's just sort of the broad remarks that I had for this session. Thank you.
Thank you, Ms. Goswami, for giving us what WRI is doing with different partners and what that hybrid approach towards providing basic civic services, including water and sanitation to urban household, is paramount to building resilience at the local level. And also, if we want to achieve sustainable development goals in the given time frame, that is, we are living in decade of action. So if we have to achieve in the next 10 years, we have to speed up and we have to collaborate, engage with each other so that it can become a smooth ride. Talking about collaboration, I think Mr. Manohar Padole has requested you for some collaboration for a colleague working in sanitation in India. So you may connect with him at a personal level. Thank you so much for your remarks on this subject. Now I would like to move to Dr. Subrita Kumar Biswal, who is Regional Head and Faculty, Entrepreneurship Development Institute of India. Dr. Biswal has previously worked with national think tank organizations like Niti Aayog, Government of India, as a specialist for National Nutrition Mission and Women Development. He completed his Master in Public Policy and Management from the Indian Institute of Management, Bangalore, and is currently working on strengthening the entrepreneurial ecosystem of India. Over to you, Dr. Biswal, for your remarks on this subject. Dr. Biswal.
Thank you, Mr. Pandey, for the opportunity and for this platform. And as many of previous speakers are highlighting about the community participations and resilient infrastructure for both Indian and the global context, it's very, very important to understand how this economy is moving. And during this pandemic, how it is responsive in nature for the both at the policy and the community level. It's very, very important. If you see, I would like to highlight a few points related to like the Indian context and also connecting to the global context. If you see the current Indian context, Government of India is really aspiring a lot in terms of like economic growth and talking about the $5 trillion economy by 2030. And the recent study is saying that it will be pushing to another 3 years. And for that, like India is looking for the one of the manufacturing hub in for the global level. And we see the urbanization rate in Indian context. I just like highlight a few points and to coming into this, how this resilience infrastructure is, the resilience ecosystem is required for Indian and the South Asian context. If we see the like this current urbanization rate is about 34.6%, and as per the global and currently the world is like 55.7% as per the UNCTAD. And you see as per the urbanizations and the population growth, by 2020, I think India will be the most populous nation in the world, and it's expected by 2030, the consumption pattern in Indian context would be double. And we see the last 3 decades, the Indian consumption pattern, if we see the particular the material consumption has been increased more than 6-fold from 1.18 billion tons to like 7.5 tons, and is expected by 2030 due to the urbanizations and the current economic mobility, it will be doubled up to 14.2 billion tons. And with that, and if you see the production, India is one of the like one of the 5th largest producer in the manufacturing sector. If you see the economic growth and the indexes, it is the one of the largest producer of the material. And if you see the waste component part, India is hardly the 20% of the total production that's been treated so far. That means, and more than 70% of the waste goes untreated. So it's very, very important to understand and to implicate the circular economy concept in the Indian context for the resilience infrastructure and all these things. So if you see if you see the recycle component for the productions and the consumptions, if you see the European context about like more than 70% of their of its consumption is recycled through different platforms, through different innovation and the technology. We see the Indian context, which is hardly like 20%. So there is huge opportunity for this kind of linear economic model to transform into the circular economic model. And for this urbanization, if you see the current ecosystem or the current trend, due to this high population growth, due to the tilting toward the urbanizations, the current urbanizations, economic mobility, and the per capita consumption is increasing rapidly for this kind of economic model. Linear economic model has to be transformed into the circular economic model to justify the economic growth in the Indian and the global context. And if you see the current post-COVID or maybe during the wake of COVID-19 pandemic, the national government in coordination with the state government and the local government and even the international agencies, they're trying to institutionalizing the many new to simplify the complex things and also institutionalizing a circular economic growth model in the Indian context, and also taking advocacy from the many international agencies. If we see the other component, the jobs and the employment and the entrepreneurship or the enterprise promotions. But if you see the rural and the urban context, in the urban there are 48, the urban context, it accounts for 48% of the enterprise promotion of the enterprise registrations, and the rural is 50%. But if you see the women work participation rate and the jobs kind of things, there are women work participation is like hardly like 20-24% within that. And if you see the G20 countries, India is in the 19th rank, and it required the massive policy reforms and its massive economic reforms for the both like workforce participation rate, both for the men and women. And we need to talk about the equity and equality in some point of time. And it requires the strong coordination between both the national government and the state governments in all components. If you see the other component for the economic growth, and if you see the context of urbanizations kind of things, in Indian context, I think Maharashtra, Tamil Nadu, they are the like the lines are in particular the urbanizations and the urban economic development and the enterprise promotions. But if you see the women participation rate and the women owned, the enterprises owned by the female, it's quite below, it's quite disappointing, if I can say. Less than 10% women entrepreneurs are in many of the cities, and it requires like a kind of incentivizing for the new economic reform in many things. So with this context, I'd like to see a few more points related to like how we need to like this linear economic model to circular economic model, and to how to introduce innovations, technology for more resilient infrastructure. It requires to adopt circular economy, and to some kind of it requires engagement, strong engagement and the participation of the government, industry and the citizens. At the same time, there is a need of the robust roadmap jointly owned by the national government, state government, city and the local governments, and it should focus at least 5 things. That's some inputs, the suggestion for this, how to justify this resilience infrastructure and the ecosystem in this future course of it. So it requires the citizen awareness and the source segregation for recycling of the consumption, recycling of the waste, and also to the waste management, and also the consumption pattern. We need to also incentivize in terms of like tax or the maybe some regulatory platform, so that we need more investment in circular economy, and also we need to think about the financial viability of this kind of innovation and the technology. We need to have a kind of specific industry specific roadmap, so that it will help in to create resilient infrastructure, resilient industry setups, particularly to support the ecological impact, and also it requires some kind of technological innovations. And finally, I would suggest that there should be a policy roadmap and the coordination between the national government, state government, city government, and the local government, and also all the industry player to justify these things. So I'll stop here, and we need to work a lot in terms of coordination between the national, state, and the city government, and also local government and the industry player, and also work for the resilient infrastructure for ease of living at the city and the urban space. And you need to also justify the rural to urban this transition. We need to give a smooth transition of the rural to urban transition in this country. Thanks a lot. I'd like to happy to take a few questions.
Thank you so much, Dr. Subrita, for giving your remarks on how different tier governments need to work in tandem, work together, and even including the parastatal agencies working in cities, in the state, they have to also take into consideration while they are implementing projects, planning for their respective cities. Thank you so much for your remarks. And I would like to request all the attendees, they can participate in the polls. It is visible on the bottom of their screen. They can go to the polls, and there are 6 questions. They can answer, they can participate in the polls, and after the last speaker and the Q&A round, we will declare the results and what our attendees think about these different issues. Now, last but not the least, we have Ms. Urvashi Prasad. She is Director Development in the Monitoring and Evaluation Office, Niti Aayog. Ms. Prasad is the Director in the Development Monitoring and Evaluation Office at Niti Aayog. Before this, she worked as Public Policy Specialist with the same organization. With over 100 publications under her name, she has also been a member of the World Economic Forum's Expert Network and alumnus of the World Economic Forum's Global Shapers Committee. She is also a member of the task force of overseeing the implementation of sustainable development goals in India. Over to you, Ms. Urvashi, for your remarks on this subject, how Indian cities can build local resilience while keeping in mind localization of SDGs. Over to you, Ms. Prasad.
Thank you. Am I audible?
Yes, you are.
Okay, thank you. So, yeah, I mean, it's a benefit of going last when you have such a wonderful panel. Very, very important points regarding urban governance, resilient cities. A lot of those points have already been made. So I will just pick on a few key points from the policy perspective, really, and aspects that I think I've come across in my work to be really, really critical. I think if we look at it from the government's perspective, one of the big challenges that we've had is that a lot of the policies, programs historically were designed for rural areas. They were designed for villages, and they were designed for rural communities. And they looked at the local structures, they built on those local structures, whether it's panchayats that we have in our villages, or the community bonding or trust that we have in a lot of our villages. And a lot of those programs and policies merely got transposed into the urban context. And that is a fundamental challenge, because as we know very well, that the urban context has its unique advantages, also has its unique challenges. The way the community structure can be quite different. I have worked in urban slums for many years, and there's a distinct difference sometimes that you find, when you go to a rural community vis-a-vis an urban slum. An urban slum can at times have a very large percentage of migratory population, so people might not even know their neighbors. They might not, or it might be very, very, the population, the inhabitants are constantly changing. So the way we think about designing, whether it's a policy, a governance mechanism, a program, has to be fundamentally different. And I think, it sounds something very basic, but I think that's where a lot of our challenges start from, that we bring in something which has been inherently designed for a rural context, a rural community, and we try to implement it in the urban context. So that I think is from the policy perspective, what we are trying to look at differently, at least in NITI, some of the work I've been involved with, we've been looking at how do we develop a health and nutrition model which is specifically for urban areas. Because, as I said, the way a health and nutrition model might work in a rural setting is probably going to be very different. The way we look at community structures, the way we look at mothers' education, the way we look at community support, education, all of that is very, very different in the urban setting. So we've been trying to look at some of those aspects, not just in health and nutrition, but in various other areas. Health and nutrition is an area that I've been closely involved with. And how do we look at the governance mechanisms in this setting? Who are the stakeholders in this particular setting? How do we organize them? Even a community structure like a self-help group, we know that it works very well in certain settings. Again, in certain other areas, it simply doesn't work as well, precisely because of some of the differences in dynamics that I was alluding to. So I think what we are trying to do is, at least, some of the work I've been involved with at NITI is at least try and build some sort of a blueprint, a broad framework, because eventually, of course, the way India's structure is, it's a federal structure. The states have a big role to play, districts, and then even going further down, the local governments, obviously. So there is going to be and bound to be a lot of adaptation, a lot of customization, and of course, some of that is also desirable and is inevitable. But holding all this together, we do feel that there has to be at least some broad framework or broad blueprint at a policy level in terms of how do we think about systems, how do we think about policies, programs in an urban context. So I think that is one very, very fundamental issue that we're trying to look at, and that cuts across different sectors. The other aspect, and of course the pandemic has given sort of a fillip to thinking about this, and has sort of accelerated a lot of thinking around this, is on public health, and that's an area I've worked a lot in. It's very close to my heart. And I think that is something where we, it's linked to what I was talking about, thinking about, systems afresh. But how do we really emphasize public health? How do we really emphasize integration of health, nutrition, water, sanitation, gender? Because, none of these are completely distinct from each other. They are all linked to each other. They all have significant overlaps and significant linkages that often in our governance structures we miss out on. We try to create committees, and we try to create some structures at the local level to try and bring about more coordination. But generally that is something that doesn't happen very effectively, and we lose out on the importance of that integration. So I think that is another big area for us and to think about, of course, at a broader country level, but very, very importantly and specifically for our cities, that how do we look at public health as a much broader concept. It's not just delivery of health services, and of course you have primary, secondary, tertiary healthcare, but it starts much before that. It starts with prevention, it starts with health promotion, and it really starts with an integration of all these different areas. So what are the mechanisms that we can put in place to make sure that this happens on an ongoing basis? It's not just when we have a pandemic or we have a crisis. Of course, we need to have the mechanisms for disaster response in place. And it's true that we've been lacking in that in many ways. Again, some cities, some states have done better, others have done worse, as is usually the case with a country as complex and diverse as ours. But we do need that basic framework in place. But it has to start much ahead, and it has to go much beyond responding to a disaster like this, but actually thinking about how do we prevent it, how do we make sure that if it does happen, we pick it up in the early stages. So I think public health per se is a big area where, the way I see it, we are currently lacking in a very, very big way. just the very understanding of what is public health and how it makes it distinct from the medicalized health system that we normally think about. So I think that is the other aspect that, at least on the policy side, needs a lot more emphasis. And as I said, that at NITI Aayog, we are trying to take some steps in these directions. We're consulting a lot of stakeholders. Precisely forums like these are really very, very helpful to get some rich insights into how we can go about designing more effective, at least blueprints or broad frameworks, which can then be adopted and, as I said, customized, changed however is required, but at least have something high level and broad in place to how do we go about designing our policies, programs, and especially focusing in a big way on public health in the context of our cities. So I'll stop here. Once again, thank you very much for inviting me. I've personally learned a lot from this discussion. Thank you very much.
Thank you so much, Ms. Prasad, for talking about how India planned its urbanization and also the policies for our cities. We all of us are aware that India has been a reluctant urbanizer, but right now, in last few couple of years, we have made specific plans for cities like Smart Cities Mission, Amrit, Hriday, Swachh Bharat Urban, and a lot of other schemes that we have planned for cities. And then definitely all these plans, we have learned how we managed our cities in the past and what is the way forward. And integrating both the approaches, bottom-up, top-down approaches, and engaging with all the stakeholders. Those are being part of this whole scheme of things. Thank you so much. And now I would like to go to the Q&A section where our attendees have posted some questions for specific users, for specific speakers. The first question I will go to Dr. Isabella, and that is from Shivi Sharma. She's asking, how do you think countries have built policies to push their economic sectors from falling during the COVID-19 pandemic? And there is one more question. I will club both these questions from anonymous attendee. It is, how do you think negotiated resilience could be built to operationalize it according to the situation on ground? Dr. Isabella.
Thank you so much. Well, these are two difficult questions. The first one, we should look at view at the moment. European countries have managed at the moment, in the short term, to keep their economy going with, in a way which has been very surprising. It seems at the moment it is business as usual. Large private firms are booming. The stock exchange, everything is booming. It's really surprising. So what happened in the meantime? European countries have been massively pouring money into the private sector with massive support to the sectors that were under threat, such as, for instance, tourism. And also, they poured a huge amount, billions of dollars, into the unemployment system. That is, people who had lost their job got a minimum, at least minimum subsidies and wages from the public sector, from the government. And it seems that it has maintained consumption, it has maintained the economic demand, and things have gone on like that. In the long term, we don't know the effect because naturally now we are faced with a huge public debt and we don't know how it will be solved, if it will be solved by inflation or question mark. Considering the next question, this is really a fascinating question, how to build negotiated resilience. My first answer would be that Mr. Manohar Patoli, the second speaker, it seems to me answered and gave a very good example of this negotiated resilience building. Another example would be, in my mind, much better than I would do, would be, for instance, the way local governments are building this negotiated resilience, for instance, in Kerala. Another way to answer this question would be to look at the smart cities concern for giving the voice to the citizens. This is an important aspect of the smart cities policies. I remember, for instance, in Pune, there was a lot of efforts to try to build this dialogue. So this is another example. And the last example that came to my mind concerning this question is Latin America, where in post-disaster periods, the examples in Maputo, in Nicaragua, where communities have managed to interact with the different levels of governance, whether local, national, or international, to bring their ideas forward, which enable them really to build resilience in the community. I could give you some practical examples, but there are many other speakers who would like to speak. Thank you.
Thank you so much, Dr. Thank you so much, Dr. Isabel, for answering the question of our attendees. Now I would like to move to, I think Mr. Manohar Patoli has also already answered 3 of the questions that were directed to him. But there is one question in the chat box also that that is talking about Carbis Bay Declaration. Can you please explain to our attendee, Ms. Shali Gupta, about the Carbis Bay Declaration? Mr. Patoli.
Sure. I'm not actually as familiar with that. I don't know if it was me who mentioned that or if it was someone else.
Okay, no problem. I think, is there any speaker who can answer this question? Carbis Bay Declaration?
It might have been one of the health speakers. I'm
yes,
sure.
Somebody else. I think it is a health declaration by G7 countries, but the details I'm not very much familiar with. So I think we will keep Ms. Shali's question in mind, and we will try to answer this question when we publish this report. She will get the information. And now I would like to move to, there is a question for Dr. Uma Maheshwaran. What do you think was the most sustainable strategy that the Indian policymakers adopted during the COVID-19 induced pandemic? And another question that is directed to you, it is, do you think policymakers have better used social media to understand what the population needs during the pandemic? Dr. Maheshwaran.
Thank you. So there were a couple of things which the government managed to do. One of the things which is I would say in terms of sustainability or in terms of a long-term view is the establishment of the Climate Center for Cities within the Ministry of Housing and Urban Affairs. So this was established during the pandemic in June 2020. So rather than looking at climate and health as two separate things, bringing them together into one particular center to provide directions to urban projects, urban investments, including smart city investment, was a decision. But this did not occur because of the pandemic, even though the plans and it has to go through the parliamentary process, and the proposals and the plans were proposed somewhere in 2018, 2019. And basically it panned out in 2020. So that is one sustainable initiative, I would say initiative which can be sustainable, because until and unless you don't have institutions, you don't have an anchorage within a government department, many of the initiatives become a project, and the project lasts for certain days and then it fizzles out. And that's the larger worry with respect to this current pandemic. Whatever initiatives are being taken at a city level or a community level, most of those initiatives are more reactionary, which is very much needed. I'm not saying it's not needed. It is very much timely and it is the need of the hour. All said and done, they are not anchored within institution. They are not anchored within a structure. So the sustainability of these efforts is a bit questionable. What I at least foresee in the near future, I was talking about the establishment of UN and also about the National Disaster Management Authority. What I really meant to say was, in India, health is still not within the purview of municipal corporations, many of the municipal corporations. There was a speaker who did mention about Maharashtra and Tamil Nadu. These are one of the few states where health is part of the municipal administration. So unlike Maharashtra, Tamil Nadu, and I think to a certain extent Gujarat, states like Odisha, Assam, UP, even states like very, very progressive states like Karnataka, Kerala, health doesn't come under the city's purview. It doesn't come under the city administration. But as you all might have seen, during the pandemic, the municipal corporations and the urban local bodies worked with law and order and worked with the communities to initiate many of the plans and programs, including establishment of health units to cater to the need. So I think going forward, that is what is going to be the game changer. In India, health will have to come within the purview of urban administration, and more responsibilities and more empowerment should be provided to these urban local bodies to take action on time. Even now, disaster management is under the purview of the district collectorate. It doesn't come within the municipal commission. So these are institutional level things which needs to be understood. And I think these actions, whatever is happening currently due to COVID, the collaborative actions, people-led initiatives, working with the governments, multiple agencies coming together, I think this has to be sustained. It should not fizzle out at the end of the pandemic. These models, what has worked, what has not worked, what created a lot of problems, what were good practices which did emerge. All these things need to be captured, need to be formalized through an institutional setup, and should sustain over time. Thank you.
Thank you, Dr. Rajsekhar. Now I would like to move to Dr. Luthra. There is a question from the audience about about the digital infrastructure, but I would like to one more question from my end, because you have talked about the cities making 15-minute cities plan, that line. I think the Paris has announced in the post-pandemic world that they are building the green recovery by 2030. They have made these plans. So how do you think that, Indian cities I'm not talking about the world city of Rajasthan or Jaipur or Amritsar. Beyond, those are in the purview of corporations. Do you think that the Indian municipalities are having the resources and the capacity to implement such kind of projects?
Thank you, Mr. Pandey. First of all, regarding digital initiatives, I would say that under Smart Cities mission, of course, the central government, I would say, gave the opportunity to some local bodies, like 60 smart cities are selected in the first place. They would act as samples. They will act as model cities, where application of smart city solutions will help other cities to experience and then execute similar plans if successful. In my opinion, this smart cities mission, it has been overtaken by the digital industry. A lot of app-based solutions are there, but may I tell you that this 15 minutes city itself is an intelligent solution. This is a smart solution, and if you go through literature and the city planning within the walled city areas, you will find that those cities, they were far smarter than the smart townships being developed now. Why I'm saying so? Because one of the concepts within the smart cities mission is the brownfield development and whitefield development. And whitefield development, where is it coming? It is on the periphery. And high income group people only they can afford that kind of properties. What are we doing under smart cities for LIG and EWS section? And if you take the case of say Amritsar walled city, Delhi walled city, Jaipur walled city, all these cities, even I went to Madurai, and there also the old city, the wall is not there, but still old city part is there, and all those settlements, they are having their necessities met within the walkable distance. So it is in this light, I would say that the digital initiatives, they may be successful for newer cities, for whitefield developments like thing, but for older parts, the older cities, they are already smartly, I would say, built. So there, regarding pandemic situation, if I see my city, I belong to walled city, I belong to Amritsar. So in within the walled city area, if I see number of COVID cases, they are way less compared to the other areas. And if you see the total data, of course, in the newspapers and in media also, it was that how many beggars have got affected by COVID-19, how many LIG or EWS class has got affected. Otherwise, Dharavi, Bombay would have been a big shot. Nothing has happened, nothing much has happened, I would say. So that way, we have to relook into the agenda of smart cities solution also. And if you see the 60 local bodies, handful of them, they have taken up brownfield development projects. Everybody has gone for whitefield development project because it's a monetary proposition also, and their application of digital technology is much more. So in this reference, I would say, definitely I would say digital technologies would help, but where, again, that's a question. And under what conditions? Because maybe most of the EWS and LIG section, they are not having smartphones also. Many of them, they don't have the phones also. So which section of the society are we going to serve? 10%, 15%, 20%? So if only 20% is to be served, where the 80% will go? So this is a big question in itself. That's why livelihood and social justice, that was my key point there. We are not doing social justice in case of pandemic solutions also. Thank you.
Thank you, sir. Talking about the have-nots and how we can provide services to them and make our cities planning and implementation specifically equitable and inclusive. Thank you so much, sir. And now I would like to move to Sahana Goswami. Ms. Goswami, there is because we are talking about the informal sector, and especially we have seen in the past that providing basic services to the people living in informal settlements, especially in informal settlements, we especially water and sanitation we have spoken about. So what do you think that the cities can do when they are addressing during the time of pandemic like situation, where we have seen that people, those who are living, because it is a complex issue when we are talking about providing civic services. So these people are also dependent on their daily income. So we have to look at their economic sustainability or also the providing basic services to them. So how cities at their own level can address these issues? Over to Ms. Goswami.
Thank you for the question. And clearly, as you have outlined in the question, it's a very complex issue. It's very easy to say that we will provide the basic services, and technically that's sort of, I mean, however complex we may see it, that's actually the easier part of it. You do highlight the critical part. It's providing the services is just one part. It's really about livelihood and employment and their income that has to be guaranteed. And I think that's where it goes into much more sort of complex territory of talking of, you know, better social welfare schemes. We sort of, and I don't want to put this on just Indian, you know, authorities. It's, I think, a problem across the world. But we sort of have this tendency of assuming that better social welfare schemes are a handout. But I think we need to change that mindset. And I think this COVID crisis, and as I think Dr. Maheshwaran was pointing out, it's an opportunity. It's showing us so many things that are needed. So for example, when we talk of good public healthcare or good public education, especially good public healthcare, COVID is showing us why it's necessary. I think on the same lines, we really have to start thinking of how we can secure, you know, the lives and livelihoods of all people. And why I sort of pointed out in my remarks was that focusing on the urban poor is important because they are the most vulnerable. If we are able to do something right for the most vulnerable, it should work for everyone else. It isn't to say that we are doing this, you know, sort of to give a separate sort of benefit. It's to ensure that because everyone has this social protection of not having to worry about earning income when you are ill. And this is unfortunately something people who are a little better off or in, I would say, salaried positions don't worry, because we sort of assume that we'll get our salary at the end of the day and we don't have to worry about that day-to-day earning of income. But when the choice is between being ill and earning income so that you can feed yourself and your family, that's when all the difficult choices have to be made. And we can provide all of the services of water, sanitation, healthcare, and so on, and all of that still won't account for the income that is required. And the only way to do that is to ensure that we have better social welfare schemes. And unfortunately, I think that goes way beyond the ambit of what we do at WRI as well. But really, those are the big things that we have to talk of. And again, COVID has really highlighted so many things that we have chosen to ignore because somehow society was going on. But maybe this is the opportunity we get to ask those questions and see what would be fair ways of doing it. And at the end of it, we have to ask ourselves why we want to do this. We don't want just, we do want cities, you know, the smart city vision of, you know, shining, bright, progressive cities, but we want them to be just and equitable as well. And if we want that, how does it happen? We then have to take a stand and say that poverty would not exist, not that poor people won't exist, because we aren't just pushing them out of the city. We have done that for really long and dump them somewhere else so that we don't them. But that doesn't work. We have to figure out a way that actually improves the situation. So yeah, that I would say is.
Thank you, Ms. Goswami. I think that is why that we are organizing this kind of webinars with CITYNET, and we are talking about localizing SDGs and how, because if we are only looking at one issue, we cannot solve this the problem of people living in informal settlements or in slums. So we have to make sure all these 17 SDGs, not just at SDG 11, but all these SDGs are achieved in the time frame given. So we can address the issues of citizens living in cities holistically. Thank you so much for your remarks. And last but not the least, I will go to Dr. Subrata Kumar Biswal, because I think one speaker has, we have lost the connection, or she has left. Dr. Biswal, you have talked about $5 trillion economy. You have talked about the role of cities. So how do you see that if we want to achieve the idea of our Prime Minister of achieving $5 trillion economy in years to come? So how do you, how our cities means play an active, proactive role in this scheme of things?
It's a like excellent question, and like it's a question for the whole nation kind of things. If you see the economic development and the role of cities, it's very clear nowadays. Like if you see the like all this municipal corporation or the like all these local bodies, government is pushing for the self-reliance or the like it's a kind of self-sustainable model. But the capacity we see the Indian context, the capacity of the municipalities or the urban bodies are not that enough to manage their own governance. It is no doubt managed by and governed by them, but typically implemented by the bureaucrats. And the alliance between the bureaucrats and the local body is not that the chemistry is not good in such a way that they are implementing the people-centric or the citizen-centric schemes. The Sahanaji was saying about the schemes and the programs. When we are talking about the entitlement, the rights of the people and the citizen, the implementation should be the basic agenda they should adopt at each level. No one should left behind. The way we are talking that you are mentioning about the localizing SDGs, and that should be the basic principle everybody should talk about from the implementer point of view and the policy point of view. Second part is that for the economic development, it requires to support the local entrepreneurs. Always you are talking about the big players and incentivizing to the all this like industry or the big industrialist, or maybe we are talking about the like FDI kind of things. When you are talking about the small and the micro, the nano entrepreneurs, there is not much scopes and opportunity to access and afford all this kind of financial infrastructures, though they are mainstreaming so far, but they are still vulnerable in this context. We need to strengthen the local economy at the city level and the local level. It's very, very important. Third part is that that's very more than 82% of the if we are talking about the jobs and employment, so far it's like more than 80% are like are there into the unorganized sector. Can you think of about some kind of policy measures to recognize them, that unorganized sector, for the some kind of social protection policies, so that their job will be intact, their family, particularly in terms of health, education, livelihoods, and also related to their social infrastructure. So there is no such kind of policy or the particularly schemes which are justifying this unorganized sector, and they're vulnerable and they become vulnerable sometimes, and they are sometimes also or like going up to the next level. So and next part is that for this we need to strongly advocate for the new technology and the innovations. It should not be like light and sign kind of things of the app based. It's much more like simplifying the life of the poor people at the like bottom of pyramid. Though it may be in the city level or maybe the urban level, the policy and the technology intervention and simplifying the whole ease of living is very, very important. So that the few points I would like to suggest. And for the 5 trillion economy, I think it's a strong collaboration between the national government, state government, and the international agencies and the industrialists at the same time, also for the consumer level. And more importantly, the behavioral change is very, very important for the policy level to bureaucrats level to implement or the local community level. Yeah, that's a few points from my end.
Thank you, Dr. Biswal. Now we are at the end of our webinar. Before I end this webinar, I'd like to thank Mr. Patole, he has answered this Kabis Bay declaration question in the comment in the chat section for Ms. Shelley. Thank you, Mr. Patole, for your proactive response to this. And before we end this webinar, I would like to go to this polls that we have posted for our audience. There were 6 questions. The first one was, do you think that the Indian government's response to COVID-19 was appropriate? And almost 64% of the participants believe that it was appropriate. 14% said no, and 22% said maybe. The second question that we asked, that do you think the COVID-19 crisis exposed weaknesses in strategic resilience across the world? Most of our participants were of the view that 74% said that yes. Others 10% no, maybe 16%. How do you see the education sector in the post-COVID world? Online is the future, or offline can never be disregarded? So despite having this tilt towards online education, our attendees are of the view that offline can never be disregarded, and online maybe be just the one supplement to the offline education. The fourth question, that do you think that keeping a close control on research projects might avoid any future outbreaks like this? So 72% believe yes, 2% said no, maybe 24%. Are you aware of the Kabis Bay Declaration signed by G7 nations? I think Mr. Patole has answered this question, and we will also mention in this report, because it was also about the health, how all the G7 nations are going to collaborate for building health infrastructure and collaboration for building resilience around health. So yes, 45% said yes, 55% said no. Why do you think that people from economically weaker sections of the society are still hesitant to take vaccine? So vaccine cost 7%, but fear of side effects 78%. Failure to follow COVID protocols at vaccination sites 5%, others 10%. So I think there are different reasons. So, but fear of side effects is leading the reason for not taking vaccines. But I'm sure that if you those who are having this kind of fear of side effects, they can go to the WHO site, and also what ICMR and the Ministry of Health and Family Welfare, they are busting myths around vaccination drives. So these were the results of our polls. I will again thank to our illustrious panel today, who have given their remarks on different aspects of building local resilience, on achieving SDGs. I'm sure that your viewpoints, your suggestions will reflect in the reports that we will be making based on the discussions we had today, and we will be sharing with all of you and our attendees and our readers of our magazine. Thank you so much once again, all the speakers, all the attendees, for being part of this webinar series. Thank you so much, and we will be having another webinar. Dr. Luthra wants to say something. Dr. Luthra.
Yeah, actually, I want to thank you and your organization for organizing such a fantastic and thought-provoking webinar. Actually, it is a panel discussion, and this should be a regular exercise. And after listening Professor Isbelle and Professor Manohar, I am also enlightened, of course, the other speakers like Dr. Subarta on policy, because I don't work on policy matters, but I have learned a lot of things. And regarding Uma Maheshwaram, sir, I am an alumni of NIUA because I started my professional career from NIUA. And I relish your thoughts, and I would love to come to NIUA sometime and meet you. And from the core of my heart, I thank everybody for giving me new lessons and new avenues into pandemic situation, because planning is taking note of everything and then proposing something for the urban and rural settlements. So in that relation, I thank Mr. Pandey to organize this webinar, and I wish many more are organize in the time to come. Thank you very much. Thank you very much, one and all.
Thank you so much, sir. And you have made my work easier. So you have thanked everyone. I also like to thank everyone for being part of this webinar. And we are doing this with CITYNET, and we are making this one e-forum update.in website where you can go and see the best practices on localizing SDGs, what cities are doing, and other urban news. You can go and look at urbanupdate.in, and we are bringing out a special edition on localizing SDGs in the month of September. So I would request if anyone wants to submit their article or any write-up they want to submit to us, they can contact Urban Update team. And thank you very much once again for being part of this webinar. We will be back next month with another webinar on localizing of SDGs with CITYNET and other partners. Thank you so much to our experts, speakers, and our attendees. Thank you so much.
Thank you very much.
Thank
Thank
you.
you. Bye-bye. Bye.
Thank you so much.
Thanks a lot. Thanks a lot.
Thank you.
Thank you, everyone.
Thank you.
Thank you.